All right, so this meeting is being recorded, and we were talking about, Christine, we were talking about the skills that APRA or the NMBA will assess you on when you do your OSCE. And these are the skills, and we have mentioned earlier that these skills could be very broad, particularly when you talk about physiological observation, for example, or when you talk about medication administration or therapeutic communication could be very broad. Risk management as well, infection control. These are really broad topics where when you join with us in NETA, we will break this down into pieces so that you will be able to know what are the particular skills that you will be assessed on. I'm not sure if, Christine, you're also familiar with these resources, but this is part of your APRA handbook, and I'm very sure this is in page probably 10 or 11 in your handbook, and these are the resources. For today's session, we will be we'll be discussing about resource number 1 and number 9. We were talking about the standards of practice, that there are 8 standards and there are 7 NMBA standards. And this is how the NMBA is going to assess you on based on the skills that they will also be assessing. So it is an integration. So, so a question that I just put on is everyone familiar, or is there anybody in the group who is familiar with the national standards of practice? And anyone can just pop out and just at least one standard. How's that? Maybe I will put that question to probably Shristi. I know Shristi is here. Oh, Shristi's logged out. Margie, one standard that you know of? Margie is just taking out her handbook.
Actually, Karen discussed just a little bit about that one, but
yes.
Well, sorry, Carissa.
That's okay. If you look into your learners portal, because I know that Margie is currently enrolled with us, lesson 1 in your learners portal actually discusses the Australian standards of practice. That's okay. We will discuss that shortly. And for the information of everyone, if you're taking OSCE, it is very essential for you to actually know the standards of practice. And the reason is, if you want to pass your OSCE, the NMBA will actually assess you based on the standards of practice. So we'll be discussing the 8 standards of practice which you need to be familiar about, then the NMBA registered nurse standards of practice. So these are the concepts that you as a registered nurse need to perform, and this is how the NMBA will actually check whether or not you are capable to be considered as an entry-level registered nurse. So when you do your OSCE, they will actually check whether or not you are following the standards. And our assessment in NETA actually integrates both of these standards, and you can see that in your assessment tool that the NMBA standards of practice is very well integrated into the national standards of practice, so you will never miss out when you do your OSCE scenarios. And of course, you need to perform according to a good conduct and ethics that is expected of you as registered nurse. So we have to ensure that all procedures that you perform in your OSCE is based on these standards. And if you're not familiar with this tag now, whether you need the preparation or not, ensure that the communication techniques and strategies are according to the standards and the code of conduct. And also you ensure that when you demonstrate these skills, you also have to demonstrate some knowledge. And when you go to these resources, it will actually let you put your knowledge into practice. And you just don't have to show that, but you also have to say that. And in our classes, we do have the powerful information that we ask the students to use when they actually do their skills. And these powerful words, powerful phrases, powerful information will actually increase your assessor's confidence in your own knowledge and skills. And that is the reason why we have put in a resource where in every skill there are different powerful words that you need to integrate in your OSCE presentation in every scenario. So these are the national standards, and these national standards are, when you say national, it is practiced across Australia. So this is not just for nurses but also for all healthcare professionals. And when APRA will assess you with your OSCE, they need to make sure that you actually do partnering with consumers, which is standard 2, for example. um, you need to know the different skills that goes into this standard. So preventing and controlling healthcare associated infection standard. If you are unfamiliar with the concepts of infection control, such as aseptic non-touch technique, for example, you need to get a preparation provider. And this is something that I myself, as a registered nurse back in the Philippines, um, I have never heard of an aseptic non touch technique, for example. We do have, say, um, key parts and key sites, which is something that I'm not familiar of when I was trained in the Philippines, and it is only here in Australia that I know of. And when you talk about key sites and key parts, what are these, and how am I going to integrate this in my OSCE? And that's something that you really need to also learn. Then we've got medication safety standards. So, over the next few weeks, we will be talking about the 8 concepts of medication safety. One we already did with one of the information session, that was labeling of injectable medications. So, in Australia, there is a standard and a color coded labeling of medications. If this is something that you're not familiar with, it is something that you need to study. There are a lot of medication safety. We have acronyms like APINCH, and these are your high risk medications. We do have the National Inpatient Medication Chart, which is the medication chart that we use in Australia. And when we say national, it means that it is the one that we use across Australia, and definitely will come out in your OSCE. And there are still a lot more concepts that we need to integrate. There is national tollman lettering, which is also part of the concept of medication safety, and this is something that we also integrate in your learners portal in OSCE. So these standards, clinical governance, partnering with consumers, preventing and controlling healthcare associated infections, medication safety, comprehensive care, which is really comprehensive because it's got 5 components of it, communication for safety, blood management, um, recognizing and responding to acute deterioration standard. These are the things that we are not really familiar in the Australian healthcare system. These are the things that we probably have done: blood management, blood transfusion, something that we have done in overseas. But what is the Australian standard? And this is something that you will learn in your OSCE. So let's talk about the skills. Medication safety, for sure, is medication administration, and the 7 other components. And we have comprehensive care that actually covers your pressure risk assessments, pressure injury, your false risk assessment, and your false injury. So we do have different charts that we will discuss and teach you comprehensively, that you will be using on your face-to-face session as well, with your pressure injury and your false risk injury. We do have communicating for safety, which is a standard handover. We use the word ISBAR to actually do a handover, and also patient identification falls in this. And we know that in NCLEX, we are required to have 2 patient identification in an Australian standard, a guideline or a recommendation is that we need to give three. Um, we need to get three identifiers of this patient. So there's a lot of differences, a lot of inconsistencies. Principle is the same, practice is different. So that is the reason why you need to have your preparation course. So these are all the 8 standards that is expected of you as a registered nurse. In NETA, we go through each standard and we make sure that you understand each standard. It is a blended learning where there's self-directed. You need to look into your students portal. The students portal is there for a reason. Most of our students who actually took their OSCE and already passed their OSCE said that the integration of the students portal, the workbook, the activities in the workbook, the scenarios, the online class, and the face-to-face needs to be there. All of them should be attended for you to be able to pass. So if you go through your workbook, online class and face-to-face, and you haven't done your learners portal, some quizzes in your learners portal, some scenarios in your learners portal, it is a bit challenging for you to pass your OSCE. So this is how we have integrated all of your learning materials according to the national standards and the NMBA standards for practice. It sounds very complicated having to see all of these 8 standards. There are terms that you're not familiar with, but this is all integrated in your NETA OSCE program. So these are the 8 standards that is expected of you as a registered nurse. Then, on top of that, the NMBA RN standards as well. So, when you do your OSCE preparation on top of the national standards, you will be assessed according to the NMBA RN standards. And it's not just you who's being assessed. We as registered nurses already in Australia, nurse educators, and all nurses that are already practicing in Australia, we're actually and constantly being assessed by our facility if we are following the standards of practice. So whatever we do to you, with you in OSCE, it is something that is in preparation for you when you become a registered nurse. So it's not just for your test, it is actually for your practice as well. And do you think NMBA has designed this OBA preparation course that has NCLEX and OSCE for no reason? They are designing this for a reason because they want to make sure that when you enter the nursing profession, you are already aware of the NMBA RN standards. So this is your practice, and we are molding you to become entry level registered nurses. So, standard 1 is critical thinking. How do you put critical thinking into your practice? Critical thinking is something that you do not learn in a snap. You learn it over time. And it is very challenging for overseas nurses to actually put that critical thinking skills in an Australian standard of practice if you don't get a preparation course. So we have integrated a lot of critical thinking skills through our scenarios, and also we do have a lesson about critical thinking. And if whoever is attending right now and who is enrolled with us, lesson 2 in the learners portal actually talks about critical thinking. I think there are three videos there that actually talks about critical thinking skills, and it's not just about talking critical thinking skills. It is actually an exercise for all the students to develop their critical thinking in that lesson alone. What else in this critical thinking? All of our all of our lessons and our online classes, we actually make you think, and making you think by asking why are we doing these things, and the rationale of everything that you do step by step. We integrate this during our classes, and this is how you develop critical thinking skills, because our our OSCE test takers actually did give us a feedback that yes, it was very effective because critical thinking was really tested during our OSCE. So this is very good. And the reason why it's very good is because we have integrated this and we're already teaching you how to do critical thinking. Um, we, we need you to think like a nurse, and we know that you're already nurses, and we need you to continue to think more like a nurse and to think like an Australian registered nurse. Number two is engages in therapeutic and professional relationship. And how do you do that? Um, in your NETA assessment tools, you are being assessed on your professional and therapeutic relationship. And you can see that in your communication, in your tick list. You can see that every time you do your scenario, how do you ask for consent? How do you greet your patient? I know back home in my practice, when I was practicing in the Philippines, we go to our patient and we do the procedure. In Australia, it is very different, and there are some techniques and ways and words that you use when you communicate with your patients. Your patients, they know what is going on as well. It's not like back home when they don't even know what's going on, what's the plan. In Australia, they know the plan and they need to be involved in the plan. And how are you going to do that when you do your OSCE? And these are the techniques, the steps that we will be teaching you on how you're going to integrate standard 2 into your skills as well. Then we have capability for practice. And this is something that you need to have. You need to be capable, and that is why we are training you, because you need to be capable of the skills that you are going to perform. And this is where APRA actually is testing you as well, your capability to actually perform different skills. So, say for example, if you go back to the skills, let's talk about vital signs. That is very common. Vital signs. How do you put your critical thinking in the vital signs? Your patient's blood pressure is 100 systolic over 60 diastolic. Looks very normal. Sounds very normal. On the lower side, but still normal. But you need to put your critical thinking in there, because you need to also review the chart of your patient, and that's where your assessment comes in, which is your standard 4. But you need to check your patient's chart. Is this my patient's normal blood pressure? Because the answer there is it really depends. For that 100 over 60 of blood pressure, it really depends if it's normal. If your patient's blood pressure is normally on the higher side, which is 150 over 90, for example, is 100 over 60 still normal for your patient? And that is the question. So if you let your patient stay on that blood pressure for quite some time, your patient probably will deteriorate very quickly. And that is how we integrate your critical thinking skills there, because you never know. APRA will give you a scenario where your patient's blood pressure is 100 over 60, but is that normal? The answer there is it depends. And probably when you look into or you think back about your practice back home, you always say, oh, my educator or my teacher, my clinical instructor told me. And each time I ask a question, the answer is it depends. Why? Because you need to put your critical thinking in there. And this is where we actually integrate your critical thinking. When you do your vital signs, how do you approach your patient? How do you integrate standard 2? It is introducing yourself and it is your communication. We do have a lot of students saying, we thought the skill was very easy. But communication, 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 communication is very important. I thought I knew how to say it to my patient. I thought I knew the exact words that I am going to tell my patient, but it is really very difficult for me, and it actually needs the skill and practice to be able to do that. So, introduction. Hi, my name is Carissa. I am looking after you today. And your name is, say, Michael Smith. How do I want, or how do you want me to call you? Because maybe the patient wants to be called Mike. If you say Michael, maybe they get upset, or maybe they feel intimidated, or maybe they don't really like you to call them Michael. So there are some techniques and some steps that we actually ask you to do for you to be able to integrate standard 2 into the vital signs. So we're just talking about vital signs, very simple skill, and we're still into standard 2. So you can see how complex it is as a registered nurse in Australia. Then standard 3, are you capable to perform that? This is where, are you trained to do it? Have you practiced the skill? Do you have the qualifications to be able to perform that skill? Have you enrolled with Netta, who is actually teaching you the skill properly? But this is more of, have you reviewed the skill so you are able to perform the skill properly? Then you have standard 4, which is your assessment. And if you have taken your NCLEX or is reviewing for NCLEX, you can see that this is actually the nursing process. The diagnosis here is actually part of your assessment, because the diagnosis here, when we say ADPIE, assessment, planning, intervention, evaluation, we were taught as well overseas about the diagnosis. And this is part of your assessment, where you need to integrate all the data that you have collected based on your assessment for you to be able to make a plan of care for your patient. So standard 4, 5, 6, and 7 is your API. How do we integrate this in your OSCE class and your OSCE assessment? Margie assessment tool, where you have the tick list, is actually through API. So there is assessment, planning, implementation, evaluation. Because if you have to go back, you're taking the test in OSCE, and this is what is expected of you as a registered nurse to perform. Critical thinking, therapeutic relationship, capability of practice, and your API, which is your assessment, planning, implementation, evaluation. So let's look into the vital signs once again. So we talk about your assessment, and this is when you actually check whether it's the right time to perform the skill. This is also to check whether your patient agrees to the procedure, and also to check the assessment itself, the vital signs itself. Um, so when you do an assessment of 100 systolic, 100 over 60 diastolic, mmHg, and you have assessed that this is actually a low blood pressure of your patient whose blood pressure is normally high, that's 100. So your patient's blood pressure is 150 normally systolic. Then you realize that it is now 100 diastolic. Then you need to plan the nursing care. What are you going to do as a registered nurse? In Australia, nursing is very independent. You need to do your nursing interventions first prior to calling or liaising to the team members, unless it is a medical emergency. So, in this case, what is your plan of care? What will you do to a patient with 100 over 60 mmHg blood pressure, whose blood pressure is normally high? So, in your planning, once you know your planning and your assessment, then we proceed to your implementation. So in your OSCE preparation course, we actually teach you some tools to actually let you perform your API seamlessly. Very easy. We teach you techniques, and you might be familiar with some of our demo classes where we talk about A to G assessment. And this is your airway, breathing, circulation, disability, exposure, fluids, and glucose. And this is a very comprehensive assessment. And that is one of the techniques, just one of the many techniques that we teach our students. We have the A to G assessment. And then what's your plan? Are you worried about your patient? That's the next thing. After your assessment, are you worried? That's where you put in your diagnosis. If you're worried, what is your plan? And your plan, how do you implement that? And when you do your implementation in standard 6, when you implement it through your A to G assessment as well. And is or are your interventions really working? That is your standard 7 evaluation. Have you documented it? Have you escalated it? And the assessment tool that we actually give you will give you the guide so you don't forget things. Evaluation is something that nurses always forget. I've given paracetamol to the patient who's already had, say, a fever of 38.5. During handover, you say, "Oh, I've given paracetamol." Isn't this very common when our colleague will ask us, "How much is the temperature now?" And you go, "Oh, wait for a while, I haven't checked. I've just given paracetamol. I thought I've solved the problem." But did I really solve the problem? I'm not sure. I haven't evaluated. And this is something that we always forget as nurses. So you are expected to perform this as entry level of a registered nurse, standard 1 to standard 7. We've integrated this together with your national standards in your OSCE preparation. If this sounds very complicated to you, um, this 1 hour session is really not enough to explain and to integrate all of the knowledge and the skills, because it's good for you to have the knowledge, but how are you going to apply that in practice? This is OSCE. This is the the examination is actually practical. So um, it is very important for you to attend the sessions that we have for you. Code of conduct for nurses, there are 7 code of conduct, and we integrate this as well in your learning, in your preparation course. So we don't integrate it in a way that legal compliance. No. How we integrate it is that we teach you about what are the concepts, what are the policies and procedures that actually go with that. It is very important for registered nurses to actually follow guidelines, think about the recommendations, critically think about these recommendations. Is this applicable to my patient? Policies, procedures, and also some regulations that the NMBA actually has put through as registered nurses. Then we've got principle 2, which is your person-centered practice. How do you involve your patient and the family members? How do you involve your patient in the decision making? I know that our practice back in our home country is that we ask patient's family to decide their um, for the patient, or we also sometimes we don't really consult patients. We just write down the plan for this patient to feel well, and no judgment in there, because we as health practitioners really want our patients to feel better. But did we involve the patient in the care? In Australia, they are very involved. They actually know what is going on. If you don't know the medication, for example, you're giving NDEP, amitriptyline. What is this medication for? I don't know. But if you ask your patient will tell you why is this medication, why is this medication prescribed to him or her, how is this medication working, and what are the side effects of the medication, and when to report side effects of the medication. Why do they know? Because we nurses actually educate them. And that is the reason why, if you are a new nurse looking after that patient, they know every bits of their medication. So where I was trained back home, I put all the pills in there. I know that these medications are medications to make the patient feel better, but does the patient really know what they are having? Um, Maybe yes, maybe no. And that is where my practice is back in the Philippines. In Australia, if you give a medication to the patient, if the patient does not know, you will be asked. Okay, so that is how we integrate person centered care. Then we've got cultural practice and respectful relationship. Australia is such a multicultural country. There are practices that we might not do for our patients. And how do we integrate this? It is through consent, it is through the knowledge of cultural practices. We do have Aboriginals. Who actually have different practices. Filipinos, like me, we do have different practices, and few other people from other country have different practices. There are patients who don't want to be looked after a female nurse, and this might come out in your OSCE. How are you going to address that? Doesn't want to be looked after by male nurses. How are you going to address that? Then we've got principle 4, professional behavior. How do you present yourself in a way that is expected of you as a person with qualification and registration? You hold a registration. When you become registered nurse, when you pass your OSCE, tick, you get a responsibility. How do you perform in a manner that it is professional? Um, that is professional. Then you got teaching, supervising, and assessing. How do you perform that? You will be teaching, you'll be supervising, you'll be assessing. Number one, to students, because you're now registered nurses, you're superior to the students. You will be supervising them, or to your other uh, maybe subordinates, like say for example subordinates, say for example the assistant in nursing, enrolled nurses. How do you do this? This is principle 5. And what if this comes out in your OSCE? If there is, say for example, you're performing a skill, and then here comes a student asking you a question, how do you do this? And then we've got research in health, which is very common in Australia because we are always in quality improvement, but also with COVID, for example, there has been a lot of researches. And the last one is health and well-being. How do you maintain your own health and your own well-being to be able to perform the task that is asked of you to perform? So in your OSCE, there might be a very stressful situation. How do you perform that in a way that you've got the right emotional intelligence to actually still perform that skill on top of the stress that you are having? So these are the expectations of you as a registered nurse when it comes to how do you conduct yourself in front of others to be still professional. And we are integrating this in your communication, in your therapeutic relationships with your patients, in your OSCE preparation course. Then we've got your code of ethics. This is again another expectation of you as a registered nurse. Um, Nurses and people, how do you perform in a way that you actually have therapeutic relationship and ethical, a good ethical, and within the legal aspect when you actually perform it with your clients, and not just with the clients, but your client's family, your patient's family, your own practice. These are your skills. How do you perform this in a way that is acceptable from others? So say for example you're doing a blood transfusion, but there are other religion, such as Jehovah's Witness, that they're not into blood transfusion. How do you do that in your practice? And this might come out in OSCE as well. Um, Nurses and your profession. So it's all about your own profession as a registered nurse. How do you maintain your capability? How do you make sure that you're actually performing this in accordance to the standards of practice in NMPA? And of course, how do you maintain your working relationships with your colleagues? So these are the things that we cover in your preparation course in OSCE. So what is exciting about OSCE? So we do have 2 weeks of online class. This 2 weeks of online class is very well integrated to the learners portal. We do have a lot of scenarios on your 2 weeks of online class. Margie could actually or probably have experienced this. And how are these scenarios integrated into an OSCE scenario? In your 2 weeks of online class, it is a flipped classroom. It is not the teacher, not like this, that I'm the one who's always talking. You actually get to communicate a lot of times. There are times that we put you in breakout rooms where you discuss with your group, and then you come back to the bigger group, and then we yarn all of your knowledge and skills together. There are times that you'll be talking in the OSCE class, where you actually enhance your communication skills. And most of the feedback on the first few days, 1 or 2 days, you go like, oh my God, I've done this several times, but I never expected that I actually have to say these words, and these words, they just don't come out of my mouth. It is a skill. And that is the reason why you are in this preparation course, because you know that you're actually doing a vital signs. You know that you're actually asking your patient to actually pull out the sleeves for the blood pressure, but then it just doesn't go out to your mouth because you haven't really practiced it. And I can see Margie just nodding her head there. Then you have your 5 full days of hands-on training in our simulation laboratories across Australia. What does this mean? Because the learners portal is really solid, that you bring to your classroom during your online class with your workbook that has a lot of activities that actually tickles your mind for critical thinking. It's got a lot of activities there that wherein when you come to your 5 full days of hands-on training, it is actually a flipped classroom where students, actually it's not a flipped classroom, sorry, it's peer teaching, where students will be teaching students because they are actually knowledgeable. They have actually practiced the skills on their own. Many times we ask you to make videos, and when you submit these videos, this is not just the first time that you have actually done your that submission. The last video is actually probably your first, not your first video, that's probably your fifth, your sixth take. What does it mean? And Margie is just laughing there because probably when you do your medication administration, maybe you've done it like 3 4 times before you actually submit the video. What does that mean? You're actually practicing already. You are actually practicing. So when you go to your 5 full days of your 5 full days of simulation. Sorry, I'm using the word final coaching. This is for an NCLEX. This I'm talking about OSCE. So 5 full days of simulation, our students actually are the ones teaching each other. One student's strength could be one student's weakness. And this is where we integrate all of the knowledge and skills together. The educator is there to facilitate. We don't teach anymore. We teach when we see that there is safety issue. Because in your online, all of the teachings are already there. When you go to your OSCE, um, our students already know how to perform wound dressing. It's just that they need to actually hold the real forceps, hold the real normal saline, and actually um, put that into the dressing tray. And these are the things that students will learn in their 5 full days of face-to-face. Students are asking, is it enough, the 5 full days? I would say yes, it is enough for you to pass OSCE. If you really want to have more confidence, your 5 full days of simulation is actually accessible with you within the next 6 months. So there could be, say, 3 face-to-faces in your area. So, say, for example, if you are in Queensland, for example, there could be 3 face-to-faces before your test date. Take advantage of that so you can learn more. The only thing is that students actually enroll late. Students enroll when they get their test date. And what does that mean? Oh my God, I only have one face to face. Don't worry, it is still enough for you to pass your OSCE. But if you really want to build your skills, we suggest that you take the preparatory class ahead of time, because preparation, as we say in NCLEX, preparation is the key. So as in any other exams such as OSCE, preparation is the key. Put a mindset that you're actually going to OSCE. There is no other way anyway. You're taking OSCE anyway. So why not grab the opportunity of that 6 months access for you to be able to prepare and increase your confidence? You have different resources. You've got your learners portal, which is really solid. And if you go through all of your learners portal lesson, for example, for lesson 1 to lesson 19, and then from lesson 1 to lesson 19, top to bottom, do every activity, listen to every videos. I bet when you go to your 2 weeks of online class, I bet you have the full knowledge already. You probably would have enhanced skill on your online class if you um, do your the next resource here is your workbook. If you answer everything in your workbook by the time that you go to your 5 full days of face-to-face, it will just be a polishing of your skill if you do it religiously. You have your assessment tools as well, which is part of your workbook. And this is just a guide. It could not be that solid because nursing is very fluid. And again, it depends on your critical thinking skills. But what we have integrated in your assessment tool are the principles that this has to be done. These are the safety measures. If you don't get this done, this is something that could be of a safety issue, and that this is the reason why we give this to you when you enroll with us, because we really want you to familiarize with these assessment tools. And we do have the pathways, resources, charts. They're in your workbook, but if you want a soft copy as well, they're in your learner's portal. You have your online and face-to-face sessions, and you do have a lot of access. You will have an access to the Australian injectable drugs handbook as well. If you don't have an access, please ask your educator. You'll be given the access, and you also have access to the books that we recommend and APRA recommends. And again, all of these resources, if they have a hand copy, so the Australian Medicines Handbook, you can borrow this in our facility. You do have your Tollefson, Forbes, and Hill. You also have your, this one is in the website, and the ISBAR tools as well is in the website. But we do have other resources such as your medication calculation and medication administration. We do have a lot of resources as well available for you. So, for more information, and if you would like to seek further clarification of this session, please do not hesitate to give us a call, contact us, or send us an email, or visit our website. Click on the contact us button, and we will get back to you with an answer to your questions or clarifications. I think that's the end of it. Is there any thoughts, any question or any clarification that you have at the moment? I'll stop the recording so we can talk safely.